5-year-old Caleb is the most careful boy in Gander. And it's not because he doesn't want to go out and play. It's because even the smallest cut or scrape could cause dangerous bleeding.
When Caleb was 6 months old, he was diagnosed with severe hemophilia A, which is a bleeding disorder.
It's a condition that's inherited where you're missing a protein that helps you make blood clots.
So when they told us he had hemophilia A, I said, okay. And the doctor said, you're not taking back? I said, no. I said, there's always another child out there got worse than what he got.
To help Caleb get better, he underwent surgery to place a portacath under his skin that distributes his medicine, known as Factor VIII.
So a portacath is a permanent IV, so it allows us to give him IV treatments 3 times a week without having to put a needle into his hand every time.
Now it was up to Caleb's parents to ensure he received his medications.
When we were in the Janeway, when he had his port surgery, we stayed in for roughly about a week so they could keep his factor levels up so he didn't bleed after surgery, and that's when the nurses there trained us how to use this portacath by inserting the needle into his chest, and that's what we did 3 times a week to give him his therapy.
I'm looking for something in his chest. I didn't know what a portacath looked like at that time. I knew what to feel for because we'd done our training. It's not so big as a nickel. And when I feel for it, I said, I guess that's where the gripper got to go. And I just done it and it was perfect.
It's amazing actually how well he's adapted to having to have needles 3 times a week. Obviously initially it's pretty scary, but he's gotten used to it even at his young age, and he cooperates pretty well and tolerates it really well.
But just as his parents were getting into their new routine, a scary complication arose.
We knew that was something wrong. We figured it might have been a kink or something.
We had to go to the Janeway because we had no access at that time to give him his Factor VIII replacements. So he had a new portacath inserted and the old one taken out, and that's when we changed his dosage.
But the portacath isn't a permanent solution for Caleb, and his mom and dad are always thinking about what's next.
Once the port comes out, which usually is probably 7-ish years of age, look for a vein in his hand, his arm, and put in a butterfly and give the infusion that way.
He's going to have to do it himself because there's times that mom and dad's not going to be around to do it.
And now, his parents work to ensure he has as normal a life as possible.
It changed us a lot. It brought us together like big time, closer, because we have 2 kids there now. Well, Caleb will be 5, and Jaden will be 7, and we does everything together.
First going off, it was really nerve-wracking. You're watching his every movement. Now, since we've gotten more used to it, accustomed to it, I don't put him in a bubble anymore. He had his first sleepover the other night, and I was a nervous wreck. The staff of the Janeway are awesome. They're like family. They're there for you, anything you need. If you just want to chat, it's not only there for the patient themselves, they're there for the family as a unit.
They're phenomenal. They're unbelievable. They weren't only there for Caleb, they were there for myself. As I was saying, that was hard on me. They was trying to do the training and all, and they were there for all of us. I'd like to thank the medical daycare and the hemophilia team after Janeway, and I'd like to thank my family and friends for all the support. Thank you.